This is Dr. Anish. I am the consulting endocrinologist at Prathima Hospital at KPHB. So 14th of November, it is the World Diabetes Day. The reason it was World Diabetes Day is because 14th of November was the birthday of one of the most important people who are related to diabetes management, Dr. Banting. Dr. Banting was the person who had first discovered insulin and who had first given insulin way back in 1920s. He had first given insulin to a set of boys who were actually suffering from diabetes, who were on the verge of death. And then we saw the miracle of life which insulin had given in those patients. On his remembrance, we are celebrating World Diabetes Day. He sold the patency for insulin for just $1 because he wanted every single person who had required insulin to get insulin. And on that great man's birthday, we are celebrating this day as World Diabetes Day, to remember diabetes, to spread more awareness about diabetes, and to help in the management of the most prevalent illness in the world, diabetes mellitus. There are two types of diabetes, first things first. There is something called as diabetes insipidus too, but that again most of us wouldn't know. It is an illness wherein there is a decrease in ADH hormone. But generally when we are talking about diabetes, we always talk about diabetes mellitus. So what does diabetes mean? The term diabetes means a siphon. So diabetes is an illness wherein, like a siphon, there is an excessive passage of urine. And the term mellitus was coined in the 1600s. Mellitus means sweet. It was coined on the basis of the urine tasting sweet. I don't know how they got to know about it, but it was in the 1600s. So it was a condition which had excess of urination, which tasted a bit sweet. So that's how the word diabetes mellitus had come up. There are two types of diabetes for the general population. So that would be type 1 and type 2. But actually there are a long list of reasons which can cause diabetes. So there is a condition called as MODY, which is maturity onset of diabetes in the young, which again has a list of conditions which can cause diabetes. Then we have pancreatic diabetes, we have diabetes due to infections, we have diabetes due to medications, we have diabetes due to pregnancy, and a list of all these conditions which can cause diabetes. Right? But the one important thing which all of us should know, unless there is a clear-cut destruction of your pancreas, we'll come to that later, but unless there's a clear-cut destruction of your pancreas, trust me, we can always work towards reversal of diabetes. And it works even more if you're obese. Once the weight goes up, trust me, if the weight goes down in a healthy way, if you follow what the doctor says, trust me, you can reverse your diabetes. And by reversal, we are talking about not taking the medications and having good glycemic control. It might not be permanent, but definitely if you're working towards that, it can be permanent. Right? So generally diabetes consists of three things. The initial thing was polyuria, which means excessive urination. And if you're losing a lot of urine, then you'll feel thirsty. That would be polydipsia. So polyuria, polydipsia are some of the most important complaints which most of the people would be having before they check for diabetes. The third and important thing is because the sugar is not entering your muscle, so the body is going to feel weak. So the body starts getting more sugar. That would be an increasing appetite, that is called as polyphagia. So an increasing appetite with a feeling of weakness, with a feeling of weight loss, which can happen in a lot of people whose sugars are very bad, an excess of urination and an excess of thirst are generally some of the osmotic symptoms of diabetes. Well, a few patients are diagnosed with that, but again, a vast majority of patients also get tested for their sugars when they have one of the complications of diabetes. What complication are we talking about? Diabetic neuropathy. Neuropathy is an affection of your nerves. So the increased sugars are going to go into your nerves and going to damage that. And the longest nerve is the nerve which goes to your soles, to your feet. So most of our patients would be having a loss of sensation of the feet, or a sensation of burning of the soles, or a sensation of pricking with pins and needles of the soles, and that is seen in both the legs, and that is often seen because of high sugars. Apart from that, yeah, the increased sugars can also affect your immune system, which can lead to a lot of infections. Most of them would be genital infections or urinary tract infections. But generally, while the American Diabetic Association, which is one of the important associations for diabetes control, while that says, yeah, you can screen for diabetes if you are more than 45 years, they also say that if the patient has a risk factor, to screen earlier. And here is the problem. We Indians, our ethnicity itself is a very big risk factor. So we Indians, this is a suggestion. Once you become more than 30, just get yourself tested for diabetes. Because more often than not, most of the patients do not know that they have diabetes. It is not a fever, it is not a cold, it is not loose stools. It is a metabolic condition which can only be diagnosed in the lab. So once you are more than 30 years, get yourself tested for diabetes. If you don't have any additional risk factors like no family history of diabetes, or if you are not obese or overweight, then you can again defer testing for 2-3 years. But if you are, get yourself tested regularly every year. It's just a test, right? And if you get to know you have diabetes, trust me, at the very onset of knowing you have diabetes, it is easier to reverse it. It's very easy to control it. Otherwise, you are going to go to the complications which are not at all good. It's just the number. Many people would be saying, it's just a number. Yeah, my sugars are 300, 400, but I still feel fine. Why do I need to worry about it? The problem is the complication. If a person has diabetes, there is a very high chance, as I already told, about diabetic neuropathy. But what would happen if I'm just having numbness, if I'm just having a pricking sensation? Once you have numbness, you wouldn't know if something is giving you pain. That's a very important sensation. In fact, in a few of my relatives who had diabetes, who had neuropathy, a mouse came and bit the person's foot. The person didn't know. The foot got infected and we had to remove the person's foot. That is how we remove the people's foot, because the infection is going to affect the foot and the person wouldn't even know about that, and we have to remove it, otherwise the infection is going to spread throughout the body, right? The vision can be damaged, and the vision damage it's not even a damage which can be rectified even by surgery, because the retina itself is damaged. The only thing we can do is just stop the person from going blind, but the patient is still going to have some visual disturbance. The patient's kidney can be damaged. Again, I have a few relatives who were having dialysis, who required dialysis at a very young age of 40 to 50 years. Then the patient can also have early heart attacks, the patient can also have strokes, the patient can have peripheral vascular disease, the patient can have osteoporosis, the patient can have infertility also, which is something which is very less related to diabetes. So just get the sugars in a normal target. So how do we diagnose it? Get a fasting. If the fasting is more than 126, a fasting we are talking about an 8-hour gap. So if your fasting blood sugar is more than 126, if after taking 75 grams of glucose, anhydrous glucose after 2 hours, if your post 75 gram glucose is more than 200, we generally do a postprandial. But if that is more than 200, or if your 3-month sugar average, the HbA1c, the glycosylated hemoglobin, that is more than 6.5 or equal to all of these, or equal to, more than equal to, then we tell the patient as having diabetes. It obviously has to be repeated twice, because it could have just been a one-off value, but if we get 2 values of these, the patient is having diabetes. But on this day, I want you to know, we can reverse your diabetes. But so even if you are diabetic, don't lose hope. We can reverse your diabetes, and we can do everything to reverse your diabetes. Just have a little bit of hope and do what your doctor tells you. Okay, so you don't have diabetes though. You're not a diabetic person. You don't have diabetes. So what is very important is not just the treatment. What is better than treatment is not getting the disease. So prevention is better than cure. We all keep telling that, right? But in diabetes, it is even more important, because we want to prevent diabetes from even occurring, because a small amount of damage can occur even at the initial phases of diabetes, and this damage is going to last for a lifetime. India right now is the world's 2nd leading country in diabetes, and in 10 years, we can say, yeah, we are the winner in diabetes, because we are going to overtake China too. And that is sad. So we don't want to get this illness, right? So how do you prevent yourself from getting diabetes? First and foremost, check your sugars. So there is an entity called as pre-diabetes. So what does pre-diabetes mean? Pre-diabetes is a condition which gives a person a higher risk of getting diabetes in the subsequent year. That is the diagnosis of pre-diabetes. That is the term of pre-diabetes. So how is that diagnosed? So if you get your fasting, if it is between 100 to 125, you probably have pre-diabetes. If your postprandial is 140 to 199, you probably have pre-diabetes. Or if your HbA1c is 5.6 to 6.4, then you have pre-diabetes. So these are the lab parameters. So what do you do if you have pre-diabetes? Obviously, when I'm saying you can reverse diabetes, you can 100% prevent yourself from getting diabetes if you have pre-diabetes. How do you do that? You have to decrease the insulin resistance. And what is insulin resistance? It is something which occurs because of an increase in visceral fat. And what is visceral fat? It is the fat around your liver, which is fatty liver. Most of the diabetic patients would keep telling us that, see, I got a scan done, sir, and I have something called fatty liver, do I have to take any medications? It is a must and should in diabetes. It is going to be there in most of the type 2 diabetic patients. So this fat around your liver has to go down. How is that going to happen? Obviously by losing weight. So how are you supposed to lose weight? Diet, exercise, and another thing which I'll come into at the end of this talk. So diet. What are we talking about diet? Our diet comprises of 3 things which we will be eating: protein, carbohydrates, and fats. Irrespective of whatever you eat, the calories come from either proteins or carbohydrates or fats. That is where we get our calories from. And we Indians, and this has been proven by study, we Indians have a carbohydrate consumption of 75 to 80% in our day-to-day diet. What exactly is carbohydrate? Most of the patients tell us, I don't have sugar. No, it's not sugar. The carbohydrate content is there in our rice, it is there in our wheat, it's there in our ragi, it's there in our jawar. So it's there in our day-to-day food which we have on a daily basis. But again, the patient will tell, okay, you don't want me to eat this, then what do you want me to eat? It's not about I don't want you to eat this. Most of our South Indian breakfast, they are atrocious for diabetic control. We eat idlis, we eat dosas, we eat parathas. All of these are very high in sugars. Suji, extremely bad in sugars. So how do we control it? We have to decrease these simple carbohydrates which are there in these and make them into complex carbs. How do we make it into complex carbs? By adding fiber, by adding protein, by increasing the protein, by increasing the fats. Fats per se are not bad. There are 2 types of fat. We have a saturated fat, we have an unsaturated fat which would have your PUFAs and MUFAs, poly and mono unsaturated fats. It is the saturated fat which is bad because that is going to cause clogging around your arteries, which is going to give you heart attacks and all these stuff. So decrease the saturated fats. What are saturated fats? Butter is a saturated fat. Palm oil is a saturated fat which is being used in most of the restaurants outside, right? Even ghee, though it might be good, even ghee is a saturated fat. What are unsaturated? Olive oil, canola oil, almonds, walnuts. They are all very rich in unsaturated fats and these are very good for your heart. They are excellent for your heart. So use these fats rather than the basic fats which we are using on a day-to-day basis, right? And have more proteins. Proteins are your cornerstone because proteins also increase the insulin sensitivity. So what are we talking about when you're talking about proteins? Yeah, we have the non-veg items like fish, like chicken, or even we have all the veg items like our pulses, like soy based stuff, or even mushrooms or any of these chickpeas have proteins in a good quantity. And increase the fiber content. It's the fiber which makes a carbohydrate from simple to complex. And the fiber is increased then changing a rice to brown rice. Increasing the brown rice fiber or changing again that to, for example, foxtail millets because that will be having more of fiber. Similarly, if you're a wheat eating person, change your wheat from wheat to whole wheat and from whole wheat to multigrain flour because multigrain flour is amazing. Or you can go absolutely keto. You can have almond based flour or you can have cauliflower based rice and they are fantastic. So change your diet. And next, activity. Activity would include cardiac, resistance, aerobic. So for the cardiac activity, it is recommended that a person does close to 150 minutes of activity per week. That actually comes down to just 20 minutes per day. So just do some activity for 20 minutes per day. And just basic walking is not activity. Activity is cardiac only if your heart rate goes to 130 per minute. So make sure your heart rate goes to whatever is specified based on your age for 20 minutes per day, and that is going to increase your cardiac boost and that's going to decrease your muscle, decrease your carbohydrate excess. At the same time, increase your muscular activity. So do alternate muscle activity every alternate day. Like one day you can do the upper limbs, one day you can do the lower limbs, one day you can do the abs. So once you keep doing this activity, that is going to prevent you from getting diabetes, right? And then the third and most important thing is the motivation. Only if you are motivated will you be able to prevent diabetes from occurring. And that motivation is going to help you do the diet and the exercise. So be motivated, keep focused, be focused, get your sugars back to normal and then keep checking your sugars regularly. And don't worry, if you do that, diabetes is not even going to come near you. We can absolutely, totally, 100% prevent this from happening in most of our patients. Thank you.